So I've got 10 minutes to go through the rotary batting technique, which involves generating more angular momentum around the vertical axis. So we're going to be talking more about rotating around like this. First, I'm going to discuss other sports, and then traditional batting, and then the rotary batting technique, and lastly, this new novel bat. In different sports, the kinetic chain involves large muscle groups around the hips, trunk, and shoulders that often generate first horizontal, then vertical angular momentum. The vertical angular momentum is generated through the horizontal axis through your body. Now, a baseball pitcher raises his front leg, internally rotates his back hip. We've just seen the biomechanics. Stretches the external rotators of your back hip that open your pelvis up, creating the X-factor stretch. When the X-factor stretch is released, the upper arm is internally rotated, and then it's released with a high velocity. In the discus throw, more than 90% of the momentum generated is in the horizontal axis. So we'd be doing, and then right at the end, you're going to have vertical angular momentum generated. In golf, the X-factor stretch was first described, separation between the hips and the shoulders. And then the velocity of the downstring is increased if the X-factor stretch is released with the correct timing in the first part of the downswing. Let me do that one again. In golf, the double pendulum has especially been described, where the momentum of the arm is released into the momentum of the club. If that makes sense. And in the last one, the backhand releases the double pendulum, and the internal rotators of the back shoulder are released with the elbow by the side in the coronal plane. You can see that on the third slide. That's the position you come from. So that's the golf downswing with the 3 stages. In particular, I'm highlighting the role of the back shoulder, where research has mainly been around the front shoulder. The carrying angle of the elbow and the holding angle of the hand result in the racket or bat being held at 90 degrees from the upper arm in the anatomical position. An internal rotation of the glenohumeral joint has been described by Elliott as the last angular rotation in the kinetic chain after the elbow extends in tennis and squash, increasing the velocity of the racket. Watch where the elbow ends up. If delayed, 30% of the velocity may be lost. In baseball batting, in a landmark study by Fortenberg, the pelvis continues to accelerate in the transverse plane through the swing after the release of the X-factor stretch until just before ball impact, in turn accelerating the rotation of the trunk and shoulders, whose angular velocity of each joint increases as the mass of the respective joints decrease. The velocity increases. In contrast, traditional cricket batting, we lift the bat up 2 seconds slip. You generate mainly vertical angular momentum. And the upper arms are abducted and internally rotated to form a figure 9 and a figure 6. And that angular momentum is generated mainly on a side-on manner with a dominant left hand. Can you hear me? How's that? So the abduction and internal rotation of both arms, what that does is in your back lift, it takes mass away from your center of mass, and it's much more difficult to change the direction of your pendulum stroke. And there's also, your arm is also internally rotated, so it can't rotate anymore through the downswing. So now we're going through rotary batting with Don Bradman. In the rotary batting technique, the back lift also begins before ball release, as in traditional batting technique, with or without a trigger movement. The elbows are kept to the side. The shoulders extend slightly as the elbows are flexed until the bat's horizontal and directed to point gully, as well as the back forearm with the bat face directed downwards. After ball release, the batters leave it around the fulcrum of the back forearm and rotates from the off to the leg side. And the bat face is now directed to point. This delays the time of the direction of the downswing pendulum until more information is gathered. Adjusting for line length and foot movement is more flexible and increases decision time. If more momentum is sought for attacking shots, the back shoulder may be abducted while the forearm is directed to point still. The front shoulder internally rotates. You're left in this position with your shoulder internally rotated and the forearm at the same level as the elbow. In Stilken study on the off drive with professional batsmen, the elbow was 15 centimeters above the hand at the end of the back lift. Before the first part of the downswing, you're in that position. The pelvis is opened in this case to the leg side, creating the X-factor stretch. When the X-factor stretch is released, the back shoulder adducts with gravity, externally rotating after release of the X-factor stretch. Note the back shoulder adducted with the elbow by the waist. The double pendulum is released, and the internal rotators of the back shoulder and external rotators of the front shoulder add to the velocity of the downswing, as you can see by the elbows doing this. As in baseball, the transfer of momentum from large to small joints occurs. Active internal rotation of the back shoulder and external rotation of the front shoulder, shown by the red arrow, accelerates the velocity of the bat after the release of the double pendulum. I'm going to leave that part out. This shot shows the change in direction of the pendulum, because in Wilmer's study, the book, when you do your swing through the shot, pronation of your forearm tends to draw the bat away from the line of the swing. But it can be used to change the direction of your your downswing as Stephen Smith does, which becomes really frustrating when people are bowling on his wickets and his stance is on the offside, and he brings his bat in front of his body and the wicket and comes out in a straight bat shot. So like a hook, when an ice skater is spinning on the ice, and they've got a lot of momentum spinning around, if they abduct their arms, what happens is momentum's transferred from their trunk to their arms. The trunk slows down and their hands speed up. In the same way, you've got your holding angle of the elbow, which transfers momentum to your forearm. And you've got your holding angle of your bat, which changes the direction from your forearm to the bat, with more mass of your thumb and radius compared to your finger and ulnar. And then in sports like hockey and golf, they also have the sporting implement directed away from the long axis, which brings us to a new novel bat, which is this. And it's got more mass on the outside half of the bat around the sweet spot. What that does is it increases the momentum of the bat when you use a rotary batting technique, as well as when there's ball impact on the top side of the bat in a cross bat shot. There's less rotation so that the ball won't go up and be caught as much. And on the offside, if it hits the outside edge, it won't rotate as much behind, so that there's less deviation behind you. So there's less chance of being caught behind the wicket. So the rotary batting technique may be developed naturally with a new bat in the beginning of a cricket career to increase bat momentum and rebound ball speed, and may give more time and reduce the risk of losing their wicket. There you go. Thank you.